sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
You get stabbed.
And we are here. Boy, that just came on fast. Welcome to another 30 minutes of Ask the Experts. Of course, we're still on every Thursday on 740 a.m., our sister station, from 3 to 4, and then we have our Ask the Experts from 5 to 6 during your drive time. You know, we really seldom get an opening on this show, but when we do, we actually do go to your emails, read your emails, because you're always asking us for different shows. Well, we looked at our shows of request, and the number one topic was ED. And for all you men, and you know what, it's not just men, and we'll talk about if you do anything with women, because sometimes it is hormonal, but we don't just have a clinic, we have a urologist that's going to be doing our show every month from Broward Urology Center. It's that's MD, Dr. Eric Chenven, and we are so lucky. I mean, I was really nervous. I said, you know what, there's so many people out there that put a shingle up and say they treat ED. You're a urologist, so welcome to Ask the Experts.
Thank you so much for having me.
I'm really glad we have you. Now, your office is in Broward, and it sounds like you are opening up a new office, but you've been around for a long time. Tell us about your practice.
Well, our practice, Broward Urology Center, has been kind of under the name of our founder, Ronald Fauer, and then Louis Yogel, who joined him back. Dr. Fauer started in 1978. Dr. Yogel joined in the late 80s, and then I came in 2003, and it was just Fauer, Yogel, and Chenven. And when we brought in Dr. Gorbati, and he joined us after doing a robotics fellowship, then we just thought it was a little better to kind of stop adding names like a law firm and really give us a brand or just a name people can recognize, Broward Urology Center. So that's why we changed.
And tell me some of the things at your office. Tell me your practice, the services that you offer, besides we're going to be getting into ED.
Well, I'd say we kind of practice the full breadth of urology, which is the genitourinary system, and that's not just men. I'd say my practice is probably about 70% men, 30% women. We deal with anything surgical when it comes to the kidneys, kidney stones, kidney cancer, obstructed kidneys, and the bladder, urinary incontinence in women, overactive bladder, bladder cancer, and then, of course, the big stuff with men, the prostate, the penis, the testicles, low testosterone, erectile dysfunction, cancers of any of the such.
Wow, that's a long list. But I was surprised when you said 30% of your patients are female.
Well, there's a lot of women out there with kidneys and bladders.
That's
and
true.
A lot of prevalence of a lot of incontinence and overactive bladder and bladder cancer and kidney stones. So,
well, we're going to get into today erectile dysfunction, and that's what the show is about. There is so much. I mean, men are still embarrassed to talk about it. And I feel that it ruins marriages. There are things that can be done. And I don't think it's not just pills. You've got so much now arsenal you can use, but tell everybody, first of all, what is erectile dysfunction?
So erectile dysfunction is really just that. It's when the erections are not working properly. It's not labeling it with a cause or a reason just yet. It could be psychological, psychosomatic, stress, big factor stress. I think there's probably not one guy out there that at some point in his life was in a stressful situation, new relationship, a lot on his mind, and lost an erection.
That can cause it, really.
Sure, and then, of course, the best way to make it go away the next time is worrying about, oh my gosh, it's going to happen again, it's going to happen again. It becomes a self-fulfilling prophecy, but that usually works itself out. But certainly there are psychological factors. But then...
Weight?
Sorry?
Does weight have anything to do with it?
Weight
Overweight.
definitely, being overweight definitely has a lot of factors to it. Overweight, one of the things that pops into my head, sleep apnea.
Really?
For men who are overweight, sleep apnea has a strong correlation with low testosterone. Low testosterone has a correlation with low sex drive, low energy, and erectile dysfunction. And some other problems too.
Know that.
Weight, I don't know if it directly
blood
causes
pressure,
anything.
Would that cause it also? High blood pressure?
Hypertension or high blood pressure, diabetes is a huge one. Diabetes hits the nerves and the arteries. Vascular disease, just atherosclerosis or clogged arteries. Everyone thinks about it in our chest, but those are pretty large blood vessels compared to the blood vessels that supply the penis. So you can imagine if a blood vessel is starting to get clogged up in your heart, that's maybe a quarter inch or even larger, a quarter inch thick in diameter, then something a 1/16 of an inch, a quarter of that is going to get clogged a lot faster. And since diabetes hits the arteries, the nerves, a lot of these things go together. You have patients that have high blood pressure, diabetes, heart disease,
sleep apnea.
A lot of causes all factor together.
Wow, I did not know that. You know what? I'm sitting here. So we got to have a little fun with the show. I'm sitting here. Did you see the movie What About Mary?
Sure.
When he was looking at the newspaper, I think it was the bra section to try to get him excited. That was I don't know why I'm thinking of that because that's not exactly how it works anymore. But first of all, let's get out of the way. Is there anything, we're talking about all these causes, that there's no way that you can treat? Doesn't matter whether it's pill, whatever you do, there's certain, I don't know if it's diabetes or if it's sleep apnea, that there just isn't anything you can do.
I think there is just about no man out there, as long as he has a penis.
Okay, that's a good start.
If he's willing to try the treatments that are available, there's only a very small percentage of men that are really not going to have adequate blood flow to the penis, that we're really, for a couple of reasons, but we're really not going to be able to improve that at all, that we still then have a surgical implant that we can use. But I think the need for the surgical implant, the way it was 20, 30, 40 years ago, while it's a good treatment and definitely men are very happy, couples are very happy when they have it done, but I think what I tell my patients is if I can get their own native body working on its own, I think they might be a little happier. But if nothing else works, then we definitely have a treatment that is a good treatment that can help them.
And there's all kinds of treatments. How do you like to, now when someone comes to your office, first time, what did you do the first time? I guess you're doing some type of a history and physical on them.
Most important thing is to talk to a guy. And men tend to be a little stoic, and
Do they really?
while we're not dentists, we sometimes have to pull teeth to try and get the information out of them. And I always encourage a patient's partner, if they have one, male, female, whatever, to come, because it takes two to tango.
Okay.
And they can often provide a more realistic idea of what's going on, because sometimes men, again, are a little stoic and they hold back a little what's going on, and the partner might be a little realistic.
That's what, even though you're a doctor, they're still that way when they come to see you by themselves?
I think, we've really developed a great team. I have our medical assistants that work with us. I've kind of trained and certain questions to ask, and they really are doing a nice professional job making the men comfortable. And these are women.
Okay, that's what I
but
kind of
making
thought.
the men comfortable and really understanding that this is a medical problem. This is, I don't know if we'd call it a disease or a disease state. And it's something that's common, that many men suffer from, and it's a part of life, and it's a very important part of life. And
So you have to evaluate them the very first thing.
certainly. So a good history, we're taught in medical school, 90 to 95% of your diagnosis comes from the history. You just actually have to take the time to ask them. So there are a number of things, and as a part of that history, we talk about not just does the penis come up and down and how well and so on, but rather also psychological factors like we led to stress in the life. Are they getting a divorce? Did they just come out of a tough relationship, work stress and whatever, in addition to how's their sex drive, just their overall mental state, how's their energy level. These are things that can be, and not always, indicative of their testosterone level, which we know now that erections are very much dependent on the male hormone, testosterone.
So you prescribe sometimes testosterone treatments?
Absolutely. If
Okay.
if our workup reveals that the levels are low and there's no other primary or rather secondary cause, which occasionally on a rare situation could be a pituitary tumor or some other hormone disorders, then we go ahead and prescribe some type of testosterone replacement or enhancement or stimulant to try and get those levels up to a normal level. We're not
I
looking
did
to
the
make guys
injections.
into massive bodybuilders for Mr.
Right.
Olympiad. We're not looking to have them, I tell them, go beat up college kids or be super macho, but just really a lot of them just aren't feeling themselves, whether it's they've lost their creative edge at work, don't have that clarity, just wake up in the morning and
Tired.
just kind of blah, tired, all that, just really getting
That's
first
where I
back to their
was.
normal self.
And I did go on the testosterone, which was amazing because the one I was on was an injection in the stomach. I think maybe 3 times a week. I hate needles. I hate more when they go in your stomach. It wasn't bad at all. It was so easy. So, if you see you're going to need testosterone and they say you're going to have these injections, it was like no big deal.
Well,
I was shocked.
there are injections, which is the classic, original, oldest way of giving the testosterone. But there's so many ways now. Fortunately, there's no pill. Years ago, 30, 40 years ago, when they did have a pill, some bad outcomes with liver cancer were happening. So
Really?
certainly that came off the market.
Wow.
But we have now topical gels that rub on the skin, just kind of like an antiseptic
Is that where
hand
you
gel.
start at, kind of a starting point?
Well, it could be a gel. There's a nasal gel that's a tiny little bit of spray that goes in the nose that you use 2 or 3 times a day. There is the gel. There's a couple of
How
different
does
types
the gel
of needles.
compared to like Cialis or Viagra?
So understand that the Cialis and Viagra are directly enhancing the normal response to achieve an erection. They're actually causing more of the phosphodiesterase or the PDE5 protein to be around in the nerves and more continuously stimulate the nerves that cause the erection, that activate the arteries to let the blood in faster into the penis. So they're not really they do not affect your testosterone at all.
Right.
So these pills alone and any of the treatments for ED are not going to be as effective or even effective at all if your testosterone is significantly abnormal and has not been normalized.
So most people just start off with the pills and they have no idea what their testosterone is.
Certainly. And
So that could be a waste of money.
it certainly can, and that's what I tell patients.
Yeah.
I tell them that if their T levels are abnormal, I don't want them to waste their time and money with the pills or any other type of treatment, let alone further evaluation like an ultrasound of the penis, because I have a feeling I'm going to get bad results because I haven't adequately prepared the patient to use the medicine or treatment or even the evaluation to get me reliable results of what their body really can do when the hormonal levels are at normal state.
Okay. Can you get a person's testosterone up and then use the pill?
Absolutely.
Okay. So we're showing you different ways, and we got so many. Before we go to break, I'm going to see if I can get a few of these questions in from our listeners. And the first one is, can you diagnose over the phone?
I think I would say with this, it's not sort of a cold or the flu, and even then, not so easy. But I think it's difficult to diagnose over the phone because you need a physical exam. You need
blood
some
work, right?
laboratory tests most of the time. And a lot of times they come from the primary care doctor having had those levels checked. And then, like I said, eventually we may move on to an ultrasound. So we're really going to get an incomplete diagnosis over the phone.
Makes sense. What about people who have used Cialis and Viagra with no results? You can help them.
So again, I think first of all we have to identify, are these patients with a low T or low testosterone state, and fix that first, and then go back. Because what I tell some of these guys, any of the treatments that we offer, they may not even need them, because if we replace their testosterone, it's possible, historically 25%, but I think those numbers, as we are diagnosing men earlier and earlier, that those numbers are definitely going to go above 50% in terms of men that can regain normal erections, normal functional, happy erections. With normalizing their testosterone, they may not need that Cialis. They may need a little extra boost, and then often the Cialis will go back to the pills and see if they work better, if at all, than they had in the past.
Can your testosterone be low if you're in your 30s?
It's not so common. Certainly if you've had cancer, radiation, and any kind of injury, believe it or not, mumps is something that can settle into usually one testicle and kind of cause it to shrivel up and kind of kill one of those testicles. As long as you have one good testicle, it's certainly more than enough testosterone a man should need, but it can be seen in the 30s. I'm telling you, I'm seeing more and more men in their 40s coming in every week.
Wow.
More and more.
Give everybody your phone number at the office.
Our office number is 954-463-6408.
And you have a lot of good information on your website. What's your website address?
It is www.browardurologycenter.com.
And if you have a question, you can call. We can't see who you are. No one can see you. Phone number here is 888-565-1470. We're here with Dr. Eric Chenven, and he is at the Broward Urology Center. And I got to tell you, this is so much better being with a doctor doing this show. Better. I'm not going to tell you better than what, but I'm just so glad we have a urologist doing this. We will be right back.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
We're back. I'm Steve-O. This is the Ask the Experts show. We're on every week. Gosh, we're 2 hours now. We're on our sister station, 740 a.m. from 3 to 4. And we're on 1470 here for your drive home from 5 to 6. And we have with us Dr. Eric Chenven. Chenven. See, I'm German. I should be able to pronounce that right. He is one of the principals at Broward Urology Center, and we've had so many people call us and ask us to do an ED show, but we have been sold out. And we finally got an opening, and you have a new office opening that's going to be state-of-the-art.
We're actually been there now
Doors
for about 3 months.
Okay.
We moved from
Big difference.
Our older, smaller office, cozy but nice, that was on Broward Boulevard in downtown Fort Lauderdale. Been our practice been there probably over 40 years, and it was a urologist's office for over 60 years prior to us even. And we just needed more space, a bigger practice as our practice has expanded. So
You're
we're now
always busy. In surgery, you're always busy.
never seems to stop. But we're down on Andrews Avenue, 2150 South Andrews Avenue, on the ground floor of a newer 2-story building. Totally gutted our space and built out a state-of-the-art office, clean, new.
Do you have a parking space with your name?
No name, but we're supposed to have a couple of reserved spots coming soon.
Got to get that taken care of. We're sitting here, we're talking about ED, and we've come up to the first phase of it in your office. You've done the physical, the history part, and tell us the different services that you offer. When we've done the pills, we've done even the, I guess, what was it, the liquid?
If that's the injections we're talking about?
No, not the injections. What's besides the pill?
So besides the pill, I think to talk about some of the other options that have been around for a while that really should be offered to every man. Certainly, I think if someone can pop a pill and it fixes the problem, it's easy. Again,
It doesn't work for everybody, though.
Certainly not. But again, even when it works for some men, they still have low T and some other problems, and there may not be ED, but they may have a low sex drive and a low energy level. And while things may physically work, physiologically, there's just not a lot of interest, and that can certainly have a big impact on a relationship. But some of the other treatments that are out there, we have the classic vacuum erection pump, the Austin Powers pump, as I like to call it, to make people understand. And that's been out there for years and years and years, and maybe a little cumbersome, but to some people that use it, they're very happy with it. You often have to use it with a constriction ring. But for some of the regenerative treatments that I'll talk about in a second, we use it for actual therapy. And it can actually help kind of the treatment be more effective. There are needle injections, or usually Trimix and other branded names, Edex and Caverject, usually a combination of 3 medications that we've been using for years. You hear a lot of it on some of these erection clinics in the radio.
Right.
Not really urologists in those clinics that are offering these kind of medicines. And these are things that are commonplace to us as urologists. We've been trained in our residency to use these things, really to evaluate a patient, what dose they're going to start at and need, so they don't waste their time and money or have a very serious consequence, side effect of those injections, which is priapism, or an erection that doesn't go away. And while it might raise a smile to everyone, when it's the guy in the ER and he's screaming in pain, after 4 hours, it is not a pleasant thing. And while they advertise that to protect themselves on the radio, it is extremely rare that we see that with a pill. It's generally these medications.
Okay.
So that's why you
How
really
long does
have
it take to work, though?
It can work in within 5-10 minutes.
Okay.
Even. But again, it really takes experience, skill, and some time to slowly titrate and dose someone up safely to a level that works. Again, that treatment is going to be like a pill, like Cialis or Viagra, that is often, or most of the time, going to take some planning. There is a lower dose Cialis that's every day that can help get back some of that spontaneity, but a lot of times the low dose is not adequate enough for men. And the higher doses really are just meant to be used as a as-needed basis, just like this needle. So again, there's some planning. It kind of breaks up the process.
Success rate with the injections, what are they?
With the injections, I think at a high enough dose, I'd say the success rate is probably in the 60, 70, upwards of 90% range. But then again, some men, don't want to stick themselves with a
Right.
needle, even though they're very small and simple to use. It's not cheap. It comes generally from a compounding special pharmacy that has to mix the medication and sends it directly to the patient. Usually runs about $150, $200 a bottle.
A bottle and one
well,
bottle.
the bottle might last for a number of injections.
Okay.
Could be 10, 20,
Oh, okay.
30 injections, depends on the concentration and how much a man needs to inject. But in the end, sometimes it can result in pain, and we're trying to kind of not have pain here in sort of a more pleasurable situation. And so some men will kind of start using that and then shy away and kind of go back again, and often shy away from coming to the doctor. Some doctors will just flat out tell them there's nothing left for you to do. And some doctors will just tell them, it didn't work for you and don't know how to do anything further.
So if they have low T, then is the injection still not going to work for them?
It may not work as well.
Okay.
That's for sure.
So it still boils back down to the testosterone.
It's a big factor. It's sort of that governing hormone for a man's body, kind of like estrogen for a woman's body. And things often don't work well with it, even if your metabolism. We talked
So
about weight
what's the
before.
next step up from the injections?
So I guess in my practice, the next step up used to be an implant, a surgical implant, which again I said is still a good treatment, but a lot of men don't really want to go and take that step into having an inflatable pump put in the penis, which sometimes has infections and mechanical dysfunction. Again, we've gotten a lot better on that with newer technology, but nothing's perfect. So a couple of years ago, I started looking around and probably saw a couple of articles at some of the regenerative therapies. And those include the P-shot, or platelet-rich, sort of a branded name for platelet-rich plasma injections, the shockwave therapy, or Low Intensity Shockwave Therapy. And the P-shot is where we just simply draw your blood in the office. We need a special machine, and I'll say a good one, because I was lucky enough to stumble on the M-Site machine, and it really just was complete coincidence that that rep for the machine came into my office that day, on a good day when I was starting to get interested in this. And believe me, 5 years ago, I would have looked at these treatments and said, this is a hoax, a hullabaloo, and so on. For sure. But we've had data come out and studies, and really seem to be effective. And I actually went and trained with a urologist, Dr. Joseph Bano, in Illinois, Peoria, Illinois, lovely town, in the heat of February, and learn these procedures from a urologist, someone that's been doing this for 6-7 years at that point, and really kind of ahead of the times, and so on. And so when we draw the blood for the PRP, we have this special machine that we isolate out the platelets, and then we numb them up and inject them back into you.
Well, I told you that this show goes by very fast, and it does.
It really does.
I didn't even get to half the questions or the ones that people emailed into us. But Dr. Chenven's going to be back next month. We will let you know the date of that show, and we will talk about more ED. Give everybody your phone number again.
It's 954-463-6408.
And the website?
Website is just BrowardUrologyCenter.com.
Give them a call tomorrow. Don't go through this. It's not worth it when there's things out there that can help you. We will be back with you next week with more Ask the Experts. Be safe this weekend. Might have another storm coming in. We'll see you next week.
Thank you.